You're listening to an archived Cabral Concept podcast. After listening to this show, check out the most up-to-date podcasts available at stephencabral.com/podcasts or search directly on iTunes. And now, welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Looking forward to our Cabral HouseCalls, where we get to reach out, talk with our community, answer their questions, wellness, weight loss, anti-aging, emotional-based support where we can, success mindset, stress reduction, toxin removal, you name it. I want to be that sounding board for you. So I want to do my best to help you really move down your path towards wellness or weight loss or anti-aging in a much more clear, concise way. So that's what these shows are all about. Each and every weekend, Saturdays and Sundays for almost the past 4 years, we've been answering your questions, typically 5 to 10 questions answered per show, 10 to 20 questions per weekend. And it's been a lot of fun. I mean, it really has. As I start seeing less people, one-on-one in my practice, I actually see more people because I read a lot more labs because I get to read them for all of Equilibrium Nutrition. But I see less people one-on-one. And as I do that, it's great to be able to augment that and really be able to hear from more people and try to give as much advice as I can. So as always, we always talk about on the podcast, we're not giving you a diagnosis. We're not giving you a treatment for disease, a cure for disease. What we're giving you is natural-based medicine. We're giving you a way to look at this from an alternative viewpoint. And what I want you to do is begin to see that there's multiple different ways to go about rebalancing your body. And when you start to look at underlying root causes, the disease name itself starts to become irrelevant. Yes, you can be diagnosed with a disease, and that's okay, and that's fine. Yes, conventional medicine does say that. But what we want to look at is how did that happen in the first place, and if we can go about figuring out those answers, and if we can go about ascertaining the information that we need on what type of deficiencies you have or what type of toxicities may be present, we're able to then rebalance at that deepest core level. So I want to go over that right now. Looking forward to opening up my Ask Cabral document here that my team nicely puts together each and every week. Big shout out to my team. They do such a great job, and there are many team members now of the IHP and Equilibrium Nutrition team. So big shout out to them as well as Cabral Wellness. So I just want to dive right in. This right here is episode 1394, I believe. So if you want to read along with all the questions, head on over to stephencabral.com/1394. All right, let's dive in. Barbara is up first. Dear Dr. Cabral, I've been diagnosed with osteoporosis at 26 years old after losing my period at the age of 14 or 15 due to an eating disorder. I broke my hip last year, and I've been trying to get my period ever since in hopes of gaining back some bone density. Is there any way I can strengthen my bones if I don't get my menses back? I am on red clover extract and full spectrum CBD, for I heard it helps bone remodeling. I'm afraid it's not enough. Any advice? Well, Barbara, this is a great question. Definitely. I mean, I understand where you're coming from. I feel for you. Work with a lot of women in my own practice and of course, through Equilibrium who have had eating disorders. And yes, it can cause earlier osteoporosis. So what happens is estrogen, I know that a lot of times in our practice, we talk about estrogen dominance. Estrogen is actually at a normal level, but progesterone's so low, it looks like estrogen is having a really negative effect on the body. And it is, but it's because progesterone's too low. But estrogen does help with bone-based support. For those of you who don't know, osteoporosis is essentially a breaking down of the bones. It's a degradation, a thinning, a weakening of the bones in general. So what we want to do is create more osteoblasts and osteoclasts. We want to create more bone density. So we get these things through vitamin D, through calcium, through magnesium, through vitamin K. So you want to take a good activated multivitamin or a good daily nutritional support. Again, I'm not giving you a treatment protocol here. I'm giving you advice. I'm giving you health-based advice. You're welcome to look into the specifics of this, but That is what we're looking at. So we want a good quality activated multivitamin, daily nutritional support. We want to add extra vitamin D to that. Typically, it's around 35 IUs per pound of body weight for adults. You want to make sure you're taking magnesium, again, everything along with that so that it does help with the bones and not pull calcium into the bloodstream. And then we want to also be using anything anabolic, making sure that you get enough protein in your diet, enough total calories. And we want to be doing strength training 2 to 3 times a week. You don't even need to do more than that. But if you could do a Monday, Wednesday, Friday with weights, that would be great. Now, again, be careful. Follow a program that's also recommended by your strength and conditioning specialist, doctor, etc. And then we can look at hormones. So how do we get those hormones to be balanced again? Well, first things first, you could run what we call, it used to be called the thyroid adrenal hormone. Now it's called the mood, metabolism, and stress-based test. It's a great one. It looks at thyroid, important, estrogen, progesterone, testosterone, your cortisol throughout the day. If that's too high, that could break down bone as well. And then you can look at your vitamin D, etc. So that's the best lab if I were to recommend one lab. And then let's give you some herbs. So what are some natural herbs that might be pro-estrogen? Well, a few of those that are really powerful, you name one, is red clover. Well, there's a couple Ayurvedic ones as well. There is bacopa, there's gotu kola, there is a hops-based extract, and typically that is, believe it or not, gluten-free. There's dong quai, which I use quite often, and schisandra berry, which I actually use quite often. It's a really great one for longevity, great for balancing the hormones. And then there's a big one as well called Pueraria. Pueraria. Let me spell it for you. It's Pueraria. I believe that's how it's spelled. Pue, and then it's raria, Raria, and that's a root-based extract. So that's one of the most potent, for sure, to get lower potency of plant-based estrogen isoflavones. You could also use a non-GMO sprouted organic tofu. And I wouldn't do that certainly daily, but a couple times a week you could do that as well, which is going to be pro-estrogen. So those are a few that we use, and those extracts can be great. So there you go. That's what I would recommend, and I wish you all the best. Jenny's up next. Hi, Dr. Cabral. I've got a question for my mom this time. She has been recently diagnosed with atherosclerosis. They think it is caused by some left breast radiation she had 20 years ago as part of her breast cancer treatment plan. I did a search for this, but I can't find any podcast topics. Anyways, her doc wants to put her on low-dose statin. I've been reading about plant-based diet and how it can slow or possibly even reverse this diagnosis. I'd love to gather your thoughts on this topic and see how to guide her to learning the root cause. Perhaps it is the radiation. Her cholesterol levels are within range, but apparently they aren't all that great for a woman her age. Thanks in advance for everything, and I look forward to hearing you discuss this dis-ease. Okay, Jenny, happy to help. Actually, I've talked about atherosclerosis on so many podcasts, but it might not be in the title, so it might not show up. So I understand that. So atherosclerosis is the hardening of the arteries, sometimes a buildup of plaque. So what we want to do is, cholesterol matters, but it's only one part of the equation. We want to look at total cholesterol. Typically for ideal, we're looking between 160 and 200. We're looking for the cholesterol to HDL ratio to be a 3-to-1 ratio, or maybe even better. We're looking for triglycerides, a little bit different, but still matters, at about 75. Anywhere between 50 and 100 is fine. We're looking for HDL ideally at a 59 or better, and we're looking for LDL at 110 max or below. Then if you go into VLDL, well, the lower the particle size, the better. So those matter. You can go into that. Then you want to look at homocysteine. That is inflammation of the arteries, okay? I did a show on vitamin B12. Simply having low levels of B12, folate, even add in some B6, trimethylglycine. All of these things can help lower that homocysteine level. Again, it's not common sense. There's no way that your doctor is going to know this because they don't study nutritional supplements. So unless they studied them, they wouldn't know. Or nutritional biochemistry, which again, MDs don't study. And that's okay. It's not their job to study that. But if you're asking your doctor for nutritional advice and they didn't study it outside of their doctoral degree, they're just not going to know because they didn't take that coursework. So how would you know? I don't know anything on anything other than I've studied. So how would I know? You can't ask me a question on it. So that's what we want to go with. And so just keep in mind that if homocysteine is above a 9, then you want to add in more of those methylated B vitamins. Okay. So super important. And then also look at CRP. CRP should be below a 1. So that's C-reactive protein. I've done shows on all of these things before: homocysteine, CRP, cholesterol, and I've done things on atherosclerosis. So Again, simple things, right? Absolutely moving towards a plant-based diet, no doubt about it. Doing a functional medicine detox. What else do we want to do? And again, I'm not saying that these cure, treat, or anything like that, and I can't say that. So I hope that you understand that. I want to be able to provide advice, but letting you know that it's just things to look into. You can discuss them with your doctor if you want. It's what I would do with myself and people in my own family, and I want to share that with you. So proteolytic enzymes, nattokinase, serrapeptase work excellent. What else can I recommend? A tablespoon to 2 tablespoons a day of apple cider vinegar, 1 in the morning, 1 in the evening, just mix it with some water. Can be great. Lemon, you can put lemon in that apple cider vinegar as well. It's like a little roto-rooter for those arteries too. So there's so much that you can do. So much that you can do. But the biggest things first are getting that body healthy, moving over to that plant-based diet, starting to do a healthy lifestyle routine, that daily foundational protocol, starting with the 21-day detox, moving to more of a plant-based diet, reducing inflammation in all areas of life, and that will be very helpful. So, Jenny, hopefully that helped. Anthony's up next. What are your thoughts on Blair upper cervical practice? I've read that people whose atlas is shifted, their nervous system is compromised because their brainstem and vital arteries are impaired. Once their atlas is in adjustment, rapid health recoveries can happen. I saw Dr. Thomas Forrest for 3D cone beam scans, and it took many measurements and tests recently. Some very fascinating stories here. I was dubious until I heard the stories and met other individuals who experienced shifts in health. Okay, so what are my thoughts on it? Well, my thoughts are, if it works for you, I have no problem with that. So for a lot of people who aren't familiar with Blair upper cervical practice, it's a form of chiropractic. And I'm not an expert in this, but I know what it is because I've studied chiropractic, not as a chiropractor, but I've studied the field of chiropractic because I need to know what these modalities are and how they can help people. And so that was a big part of my education, understanding acupuncture, understanding chiropractic, and having that knowledge so that I can refer out as needed and know it's very beneficial, because it's not my job to actually work every different field. It's my job to know about all the different fields so that I know what's right for what individual. So Blair upper cervical practice is something to look at, and here's why. So I would say chiropractic gets a lot of its credence from being able to help someone with back pain, okay, because it works in the spine. But chiropractic is much more than that. You can find a chiropractor who does no adjustments, like no adjusting at all. They might do active release. They might do a Grafton-based method. They might do a Goscue for posture. They might do functional range conditioning. They could do gua sha, or actually I think that's grafted. We do gua sha in traditional Chinese medicine and bagua, and they do something called, I believe it's grafted. But again, don't quote me on that. That's working with soft tissue and kind of breaking that up. But anyway, Blair chiropractic or Blair upper cervical practice works on something called the atlas and the axis. And this is in the neck-based area, the cervical vertebrae. I believe it's C1, C2. Again, don't quote me on that. Not an expert in this. But here's the thing. I don't think that there's a lot of negative consequences from trying. So when things have very little downside, acupuncture, massage, some light sauna, getting out, of course, if you feel lightheaded or anything, chiropractic, I don't have a problem with it. I really don't, right? And not at all. So no problem with it. Give it a shot. And if it works for you, fantastic. There's usually not one thing. I just want to share that with you. Meaning look at the de-stress protocol, diet, exercise, stress reduction, toxin removal. It's not going to get rid of toxins. Rest, emotional balance, right? Is that what caused the tension in the first place? And then supplement protocols and success mindset. So again, being out of alignment could add one more stressor on the S in the de-stress protocol, but I would say use that as part of your overall healing modality is how I would look at it, okay? Jan's up next. And this is coming in from, so anybody who's wondering where the questions are coming from, this is October 20th, okay? So we are now about 5 weeks behind. We've been floating between 4 and 6 weeks. The best I caught up was almost to 4 weeks, but now we're floating between 5 and 6 weeks behind. We just get more questions. And when we get more questions, there's just more of a queue. That's all. All right. Jan's up next. Jan's asking, Dear Dr. Cabral and team, I'll make it short. I like your approach, your podcast, your work. I have a question for you as an expert in the field of ketogenic dieting and health issues, since the doctors I'm consulting with have a very traditional approach. I'm a male, always lean, 40 years from Germany. I have gastritis for a long time, most likely coming from bile flowing back into the stomach. Gastroscopies always showed little red stomach lining, rarely some erosions. reason unknown. Was on PPIs for a long time. I changed my diet to ketogenic, which I'm now on for 2 years. I stopped PPIs and also tried HCL, sometimes ox bile if I had a protein and fat-rich meal, since I sometimes feel sick if I ate too much fat or protein in one meal. I feel better in regards to digestion now. The new gastroscopy shows no improvement, eventually even a worsening of the problem. The doctor says, stop eating high-fat diet with lots of salt, sodium, potassium, etc. Switch back to low-fat in many small meals and use PPIs again, probably forever. Now I'm very sad and lost. On the one hand, I feel much better eating in ketosis, and in regards to general health and feelings, on the other hand, my stomach problem does not seem to change and even gets worse. Any idea or advice would be appreciated. Best regards, Jan. Jan, I'm happy to help. So what I would say is that being a male with stomach issues, being already lean, maybe ketogenic diet's great for you, but I just want to make sure, of course, that you're getting enough plant-based food in there. If you're not getting enough veggies in there, then it's not going to be as healthy in the long run. So what I would say is this. Let's almost say, forget about the diet for right now. Let's stop that for a second, right? Because the diet matters in this case, absolutely. But what's going on with your stomach? That's what I want to ask. Because the food's not directly doing it, okay? So here's my thoughts. You may have a hidden H. pylori-based infection. And the only way you're really going to know that is to do a stool-based test. So you could do a stool-based test, check for H. pylori. We run a 3-day, which is the best test out there. And it's again, none of these are our labs. I just want you to know that. They're all CLIA certified labs for the most part, all of them. None of them are Equilibrium Nutrition. We simply use these labs. We send them to you. Doctor signs off and ship them to your home. And you take the test. We get the results back and we give you the plan of how to rebalance that body. So that's what I would look at. Like, what's going on with your gut? Why is your stomach inflamed? What's going on? Well, why is your liver? Like, what's going on with your liver, your gallbladder? So that's what I recommend. Certainly, I don't recommend a high-fat diet with anybody with gallbladder issues. That would be probably the last thing that I recommend for sure. So it's hard for me to give you exactly what to do when I don't have enough information. But lab testing, if you could only run 2 labs, this is what I would do. Yeah, for sure, I would run that parasite and bacteria test, the stool test. And I would run the Candida metabolism and vitamins test, formerly the organic acids test. And you can check those out at equilibriumnutrition.com. I'd run those 2. You're going to get so much information for what's going on. And then we can start to look at rebalancing the body at a root causal level. All right. Thank you for writing in. Tom's up next. Hey, Tom. Hi, I'm 19 years old, and over the last 3 months, I've been so busy and have found it hard to eat. I rarely feel hungry anymore and have lost 15 to 20 pounds. I rarely have daily bowel movements anymore and appear very thin. I used to love going to the gym, and now I hate it. Would love to hear your suggestions, opinions of how to rebalance and gain some healthy weight back. Thank you, Dr. Cabral. This, to me, is straightforward with Tom. Again, it's only straightforward to me because I've been doing this now for more than 2 decades, but over 20 years. So here's the thing. Something's going on where you're super stressed. You said you're busy, but that busyness sounds like a lot of stress. When you're stressed, what happens? You shift in the sympathetic nervous system. What happens? You start to feel a little bit more irritable, a little bit more anxious, a little bit more overwhelmed. You start to really shift in that, again, fight or flight sympathetic nervous system. When you're in that side of the nervous system, your body starts to shut down and slow down digestion, your need for food or your want for food, because why? Food is digested in the parasympathetic nervous system. You should be relaxed, at ease. Now, some people do get hungry when they get anxious. There's no doubt about that. They're looking for some serotonin, maybe some dopamine to kind of calm those nerves. But chronic-based stress, certainly this is where you seem to be in right now. And now you're not getting enough food, you're not getting enough nutrients. You lost 15 to 20 pounds. Well, in my opinion, we need to at least get some smoothie in you while you're still stressed. Why did I say smoothie? Or even some oatmeal or oatmeal, because they're liquid foods. They're easy to digest, because if I put a big meal in your stomach right now and you're this stressed, it's just going to sit there and ferment, putrefy, cause bacterial overgrowth. We don't want that, right? So we need to work, number 1, Tom, easy to digest food. Number 2, we need to get you out of that sympathetic nervous system stress. Try meditation twice a day, 1 in the AM, 1 in the PM, 10 minutes twice a day. Work on visualizing a better future from where you are now. Start to work towards that. Listen to my Motivation and Mindset Mondays. There's so much that we need to do, but don't even worry about the gym right now. You'll want to work out and move your body once you get some energy back, when you're less stressed. But right now, your body's so stressed, you're losing weight. Your body knows that it shouldn't burn excess calories because you need all the calories you can get right now. So Tom, that's my advice. That is exactly what I would do, where I would start. Easy to digest meals. And then again, you can run what is called the mood, metabolism, stress-based test. That'll show you your adrenal levels, thyroid level. And again, if those are off the chart, you can do that along with a minerals and metals test, and you'll be able to see what's going on. So really important, because when you run those labs, you actually see data points, and the data is undeniable. So meaning when someone runs a lab and they see the numbers, they're like, oh yeah, I guess it really is true. Like, it's proof. And that's why I just think for a lot of people, the proof is what you need to be the onus to get started on changing your life. And that's what we want for everybody, right? We want to be able to help you change your life so that wherever you're at right now, you can begin to take that next step forward. And each and every day, if you take another step forward, you will eventually achieve everything that you've set out to do. So we're going to keep it at that for today. We've got a big question coming up next, a longer one from Jacqueline. She'll be first tomorrow. I do hope that you'll tune into tomorrow's house call. Again, I try to keep it 5 to 10 questions each and every day, 10 questions minimum per weekend, making sure that we give back and really try to answer our community's questions. Really appreciate you. This being kind of the Thanksgiving week, it's just one of those times to stop, just give gratitude, and just say how much I appreciate all of you. So thank you again. Do feel free to share this show with anyone you believe it can serve. Are you ready to heal yourself and then go on to heal others? If so, the Integrative Health Practitioner Institute can help you discover proven functional medicine protocols that blend the best of 7 different healing disciplines from around the world. I personally share with you the exact handouts and protocols I use in my private practice that enable people to get well, lose the weight, and live longer, stronger. I want to pass this information on to the next generation of health coaches, and that is exactly why I created IHP. We are the future of the health coaching industry, and the skills and knowledge you will learn will make you an in-demand certified health coach anywhere in the world. Although we have many medical professionals taking the IHP certifications, no experience is necessary, and half our members have no previous health certifications. At the Integrative Health Practitioner Institute, our motto is a health coach in every home. Our goal is that you take this knowledge and then share it with family, friends, loved ones, your community, or in a practice where you create a career you love and can be proud of. The global IHP community is filled with some of the most kind and caring people in the world, and we can't wait to welcome you into our world soon. For more information or to set up a discovery call with one of our IHP Health Coach graduates, simply head over to integrativehealthpractitioner.org.